How do dementia types impact treatment and prognosis? Imagine trying to fix a car, but each model has different parts and needs different tools. That's similar to how each type of dementia requires a unique approach for treatment and understanding what to expect over time. Dementia isn't just one condition but a collection of different diseases that affect the brain in various ways. Knowing which type someone has is key to providing the best care and understanding how the disease might progress. Alzheimer's disease is the most common form of dementia. It involves the buildup of certain proteins in the brain that cause nerve cells to die. Treatments mainly focus on managing symptoms with medications like cholinesterase inhibitors, which can help improve memory and thinking for a little while. Another drug called memantine may slow some decline. But these medicines don't stop the disease, they only help with symptoms. The progression of Alzheimer's is gradual, usually over many years, with most people living about 8 to 10 years after diagnosis. Eventually, the brain's degeneration leads to severe cognitive and physical decline, and the disease is ultimately fatal. Dementia with Lewy bodies is another type that affects thinking, movement, and behavior. It involves abnormal protein deposits called Lewy bodies in the brain. Treatment often includes cholinesterase inhibitors to help with cognition, but patients are very sensitive to certain medications used for psychosis, which can cause dangerous side effects. Parkinsonian symptoms like tremors or stiffness may be managed with carefully chosen dopaminergic drugs. The course of Lewy body dementia tends to be faster than Alzheimer's, with symptoms fluctuating and visual hallucinations common. Over time, it leads to increasing disability, and the prognosis can vary but generally involves a steady decline. Vascular dementia results from damage to blood vessels in the brain, often after strokes. Treatment focuses on controlling risk factors like high blood pressure, diabetes, and high cholesterol to prevent further damage. And like Alzheimer's, medications specifically for dementia may be less effective here. Lifestyle changes and rehabilitation are important parts of care. The progression can be stepwise, meaning symptoms worsen suddenly after new vascular events. Sometimes, vascular dementia occurs alongside Alzheimer's, making the outlook more complex. Early management of vascular health can slow down the decline. Frontotemporal dementia affects the front and side parts of the brain responsible for personality, behavior, and language. It often starts earlier in life, around 45 to 64 years old. There are no medications proven to slow its progression. Treatment mainly involves managing behavioral symptoms and supporting communication. Behavioral changes can be severe, and patients may develop difficulties with speech or understanding language. The disease tends to progress quickly, leading to significant functional impairment within a few years, and the prognosis is generally poorer compared to Alzheimer's. Sometimes, a person may have more than one type of dementia, called mixed dementia. This combines features of Alzheimer's and vascular dementia, making treatment more complex. Doctors need to address both neurodegenerative and vascular issues, which can influence how fast the disease progresses. The prognosis can be more unpredictable and often faster than with a single type. Other types, such as Parkinson's disease dementia or Creutzfeldt-Jakob disease, have their own specific causes and courses. Parkinson's dementia involves managing both movement and thinking problems, while Creutzfeldt-Jakob disease progresses very rapidly and has a poor outlook. In summary, understanding the specific type of dementia helps guide treatment choices and provides insight into what to expect. Treatments are tailored to the symptoms and underlying causes, and prognosis varies widely. Some dementias progress slowly over many years, while others can worsen quickly. Accurate diagnosis by healthcare professionals is essential for personalized care, planning, and support. Always consult medical experts for advice tailored to individual situations, as each person's experience with dementia can be quite different.